Hi guys, and welcome back to my channel. My name is Jamileh and I'm a junior doctor and mum working in the UK. In this video I am taking you with me on a set of on-call shifts as the senior house officer, FY2 doctor working in acute surgery. If you're new here, please consider subscribing and I hope you enjoy this short vlog. Being a bit of a wild swimmer addict, I love to start my day with a swim. This isn't always possible, but if I'm going to be working for the next 12.5 hours of the day, a quick, cool dip really clears my mind, making me feel refreshed and super happy. It was raining and I was the only one on the beach. After my swim, I came home. Jamileh had taken Arlie to his childminders. I had a shower and walked to work for 8:30. So I'm just arriving into work now. I hope it goes okay. At least you guys are coming along with me, moral support and all that. I arrived, collected some clean scrubs and went off to handover, which starts at 8:30 AM. I was on call for surgery, so also holding the bleep, which I'll talk more about as we go through the vlog. When you're on call, the day is from 8:30 to 9 PM at night, so 12.5 hours. Hi guys, so I obviously haven't had much time to do any vlogging this morning. I started off the day by just checking no one's coming in. I started off the day by doing a ward round with the consultant. We had a handover and then you do the ward round, so you go and see all the acute patients. And then today I'm holding this bleep. And I've also got a mobile phone which contains all the patient bits of information as well for the patients that are on the ward. I think I've shown you our iPods in a different video, but this is a phone and it's got all the patient info bits as well, so it's quite good. So people either phone me on this phone or give me a bleep, which is quite an old-fashioned thing now, but it still gets done. And I get referrals in from the GPs, from the emergency department doctors, and also sometimes any community hospital doctors might give me a call if they need to refer a patient in. So that is what I've been doing this morning. I've been trying to sort out patients on the ward with some of the Foundation Year 1 doctors, but also if I get any bleeps, I need to go and answer them and sort out the referrals. So it's been quite hectic, but it's really interesting and you learn a lot on the on-call jobs. So I will go and see the patients when they come in and do bloods, put a cannula in, come up with a basic management plan. Maybe they need to go for a scan or something like that, need certain medications. And then you have the opportunity to present and talk to your registrar or consultant about the patient and the case. And they confirm, oh yes, that's a good management plan, or they might suggest something, oh, should we do this? And you are, running around doing all of those sort of jobs that come up. So yeah, it's quite busy. I'm pleased to have my swim this morning. I'm just looking outside and it's a bit rainy and horrible, so I feel like I made the most of my day this morning. And I'm just having a little break now. I'm sat in one of the clinical rooms, which is where we see some patients and bring them in from the waiting area if they get sent in from the GP. So I'm just sat here having a quick break. It is, I don't know what the time is. Yeah, it's just 2:05, so not too bad, and I just thought I'd escape while I could. But even 15-20 minutes, it's important just to sit down. Oh, now that's probably a call from a GP, so I'm just going to answer that now, guys. Hello, surgical SHO. As the SHO on the receiving end of the phone call getting acute referrals, I always make sure to check the patient's name and age, find out who is calling, is it a doctor in the community such as a GP or an A&E doctor for example, and then it is really useful if the person referring the patient uses a communication tool like SBAR, which is something I learnt about a long time ago in medical school. What is the patient's situation, their background? Has the clinician referring done an assessment of the patient?
so examination, observations, that kind of thing, and then find out what the referrer is recommending. If they're calling the on-call surgical SHO, which was me, it is usually because they want to refer their patient into us acutely or need some surgical advice.
Bye! This is not the correct way to wear a mask as well, guys. We're putting, you go around with our masks on, obviously, and I tend to do this little twisty thing. Yeah, it goes like that, but just to have a bit of something to eat. Yeah, probably should have just spoken to you with it off, but I'm just so used to doing this. I look like I've got no neck.
I wasn't able to do a complete vlog as I was so busy for the rest of the shift. I did several catheters, cannulas and bloods, and lots of clerking, which is where you take the patient's history, examine them, write in their notes, including your working diagnosis, and come up with a management plan. All of this in between phone call referrals. On Saturday morning, I didn't quite have enough time to go for a swim, but I did do a quick run around the block before heading to work. The worst thing about working at the weekend is missing out on time with Arlie and Jamileh, who had a boys-only weekend without me. Even just these 20 minutes outside makes me feel better and ready for the day.
I've had quite a busy day. The difficulty is when you get your bleeps, might be in the middle of something or in the middle of doing a job like prescribing or doing a cannula or clerking a patient, and then you have to go and answer the phone. So it's just juggling all of that. And I think a key thing about being a foundation doctor is just trying to be super organised and asking for help when you need it and allocating tasks as well. Your colleagues are there as part of a team and you work together to try and do the best for your patient. So it's been a busy, interesting day and I'm so excited to get home. I'm a bit sad at the moment because it's 7 o'clock. So I've just spoken to John and he's at home with Arlie giving him his bath. So I feel a bit sad that I'm not at home for that. But anyway, it's one of those things. Next week I won't have super long day, so I will be home for bath time. Looking forward to going home and just crashing on the sofa with John. What are some of the things I've done this afternoon? I've done lots of practical procedures, cannulas, bloods. I've been chasing CT scans. I've been chasing ultrasound scans, booking for scans for patients to try and come up with diagnoses. I've been talking to doctors on the phone who are concerned about their patient and are worried whether they need a surgical review. My phone's going off again. So, yeah. It's never ending. Hello, surgical SHO.
After quite a long day and not much vlogging again, guys, sorry, I was able to make my way home at around 9:20.
Hi guys, so I don't know how much you can actually see me, but I'm just walking home now. We've just had the handover at 9 o'clock and 9 p.m. Where all the night doctors came and we handed over all the patients that we had seen that day to the night team and told them things to chase and informed them of patients that we hadn't yet seen or were to come in. One thing I really love about working in the NHS is just all the people and your colleagues that you work with. I think that if you're a people person like me, it's definitely such a good profession to be in. I'm going to go home, see John, look into little Arlie's bedroom. He'll be asleep by now. And I really hope we have a better night tonight. I don't know what happened last night, but it can only get better. If I get more than 2 hours sleep, I'll be happy. I got up at about 6:30 this morning. I did a run, no swim this morning, but I did do a run, and then I got home, changed Arlie out of his nappy and pyjamas, and I put his clothes on, and then played with him for a little bit, had a shower, had some breakfast, made my lunch and food for today, and then just had a little catch up with John. I also put on a wash, and I made some food for Arlie for his dinner. So yeah, sort of busy morning before coming to work, but it was nice to have at least half an hour with my baby before coming to work, because obviously I'm not really going to see him all day, but maybe I'll try and FaceTime later. There's a few more patients to be seen outside. I've just writing in the notes for a patient that we've just sent home. He came in and had an operation a few weeks ago and a drain was left in, so I just reviewed the patient, did some bloods and ensured that everything was okay, and we've taken out the drain now, so I'm just doing a bit of the paperwork for him. And I've still got a few other patients to go and see. A patient in urinary retention, so they can't do a pee, so probably put a catheter in and try and find out the cause of them going into acute retention, and a few other patients that are sat waiting who have got things like abdominal pain. There's someone else going off to theatre who we've been preparing for that, so doing the appropriate bloods, prescribing medication and fluids before they go to theatre, and that person's going to have their gallbladder taken out. Yeah, so it's been quite busy. I'm looking forward to going home.
If you enjoyed seeing this little glimpse of what it is like as the surgical F2 SHO on call, please give this video a thumbs up and comment down below if you made it to the end. After my on-calls, I had a day off, which was wonderful. Arlie and Jamileh had nursery and work, so I met my cousin for a sunrise swim in Falmouth, which I thought I'd share here because it was so beautiful. Thanks for watching.